As healthcare in America is changing. Right now, I probably could say this with some level of certainty. Most people don't really think about who's paying when they go to the doctor. They go to the doctor, their health plan is paying, unless you're indigent and you actually understand the pain, the burden, how hard it is to manage your healthcare benefits. But in an employer-based healthcare market, it's challenging for people to really make a connection between money and healthcare service. I think as that changes and more people have the unfortunate or misfortune of understanding what those who have never had have to deal with, folks are going to be a little bit more critical in their healthcare decision making. And so they're going to start thinking about, do I really need to have 2 MRIs? Can't the doctor get the results from the previous doctor before they send me for another test? And I think it's going to be a combination of will around how we manage our own personal finances, but also a matter of will around how we manage our own healthcare outcome and where we sit and how we feel about ourselves. And so I'm pretty confident that as the transition around healthcare financing continues to change and move, the decisions people make around access to information and using information in a meaningful way will also shift. Excellent question. I think there's a concern around whether or not the funding that's been allocated in HITECH, and there are very few dollars actually associated with healthcare reform, like new dollars. I think there's some concern about whether or not the healthcare reform dollars and the HITECH dollars will still be available with the change in leadership at the state level in Washington, D.C. But in all honesty, I don't know if I'm just very Pollyannish. I think that we're down a path and that we're too far to go backward. And so just like technology has transformed banking, has transformed travel, has even transformed restaurant reservations, technology is going to transform healthcare. And so I think we've gone down a road that we cannot go back. I don't think it's in anyone's best interest to go back, and that we have to figure out a way to make it work. For those who want to make money off of it, we can make this work. For those who want to improve population health, we can make this work. And for those who just are passionate, like public social conscious servants like me, I'm pretty confident that we'll make this work, because we're way too far down the road to go back.